So today our topic is about schizophrenia. Basically, firstly, we define what is schizophrenia and what are their role in our daily activities. Basically, it is the genetics of schizophrenia natures versus nature in the psychological disorders. First, we define what is a schizophrenia behavior. Basically, schizophrenia is a chronic mental disorders that affect how a person think, feel, and behave. People with schizophrenia may experience the hallucination, delusions, and disorganized thinking. There are some common symptoms of these disorders. For example, the symptoms include the hallucinations, seeing or hearing things that are not real. Delusions, for example, trouble thinking clearly and lack of motivation or emotions. Why study schizophrenia? Basically, it is understanding that schizophrenia helps doctor and psychologists treat, prevent, and support affected individuals and families. Nature versus natural explained. Nature means genetics or biological influences. Nurtures mean environmental influence by like upbringing, stress, or life experiences. Genetics in psychology. Some behaviors and orders are influenced by genes passed from parents to children. Schizophrenia is a genetic component, meaning it often run in families. Family studies, for example, family with a close family member with schizophrenia are make likely to develop it than those with no family history. So in the twin studies, identical twins show how similarity from schizophrenia that fragmental twin suggestions genetic influence. Adoption studies. If adopted children with biological relatives who have schizophrenia still have higher risk, this support genetics influence rather than family environment alone. Genetics makers. Scientists have found some ton genes variations that are more common in people with schizophrenia, but no single schizophrenia genes exist. Brain structure differences. Some brain of people with schizophrenia show difference in areas like the prefrontal cortex and hippocampus, which can be influenced by the genetics. Nurture environmental factors. Environment influence like stress, trauma, parental complications, and infected may trigger schizophrenia in someone who is genetically vulnerable. Parental environment. Problems during the pregnancy, such as nutritional deficiency or infections, can increase risk of schizophrenia later in life. Stress and life event. Major stress, poverty, urban living, or drug use can increase the likelihood of developing schizophrenia, especially in genetically at risk individuals. Diathesis-stress model. This model suggests that schizophrenia develop when genetically vulnerable interact with stressful life experiences. Genes environment interactions. Nature and nurture work together. Genes lead to the gun environment pulse the triggers. Neither is enough alone is most cases. There are some treatments implications. Understanding both nature and nurtures help doctor medications, therapy, social support to treat schizophrenia more effectively. Prevention strategies. Early detection of high risk, stress management, avoiding drugs and healthy lifestyle may help reduce onset or severity. So, as a summary, schizophrenia is caused by a mix of genetic factors and environmental factors. Both play a role in its development. So, this is all about schizophrenia disorders, their effect in our daily life, and some of the genetic and mental issues. Thank you so much.